Hello, everybody. I'm Abby from Drop Bio Health, and it's my pleasure to welcome you to tonight's event on egg freezing with IVF Australia. Before we start, in the spirit of reconciliation, Drop Bio acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Now, we all know the impact that our lifestyle can have on how we feel day to day, but our daily habits can influence so much more than just how we feel, from brain functioning to sleep, energy levels, and even aging. So if you want to discover the impact that your lifestyle might be having on your overall health, click on the link in our chat box to take our at-home finger prick blood test today called Wellbeing. And rather than just talking about well-being, I actually wanted to just give you a quick look at the service and how it works. So just bear with me. Now, today we're really excited to welcome Dr. Dave Listijono from IVF Australia. Dave is an obstetrician and gynaecologist whose PhD in reproductive biology focused on the causes of poor egg quality in older women and received the Commendation for Research Excellence Award at UNSW. So he really knows his stuff in this area, and we're very lucky to have him along tonight. In addition to his busy clinical practice, Dave continues to be involved in teaching and research and has devoted his career to the pursuit of excellence in women's health. Welcome, Dr. Dave.
Thanks very much, Abby.
Thanks, Dave. Yep, we can hear you. Can't wait to hear from you a little bit more shortly. And today, I also just wanted to introduce a patient of IVF Australia who will be joining us. We're really lucky to have the lovely Marianne, who's going to share her experience personally of egg freezing and answer some questions that you might have from a patient's perspective. So if you do have any questions that you would like to have answered by either Dave or Marianne, please use the Q&A box at the bottom of the screen to submit those, and I'm going to ask them a little bit later on tonight. But thank you also, Marianne, for joining us today.
Thank you, Abby, for having me. It's a pleasure. Nice to meet you, Dr. Listijono.
Same here, Marianne.
We're really looking forward to hearing your story, Marianne, and hearing a bit more from you, Dave. So look, without further ado, I'm going to hand over to you to start, Dave. Can you please take us through your presentation, which is going to cover the egg freezing process, and then Marianne and I are going to jump back in a little bit later and have a chat and answer some audience questions. So over to you, Dr. Dave Listijono.
Excellent. Thanks very much, Abby. Hi, everybody. Firstly, I want to thank Drop Bio Health for having me this evening. It's a pleasure to be talking on this very exciting webinar. I'm just going to share my screen with you guys. It's hard because I don't get any feedback, so hopefully it's all you guys can see my screen. So today I'll be talking about the process of egg freezing and what it involves and what you expect out of it. At any point, if any question, just feel free to reach out through the Q&A section. So we've already done a welcome to country talk. Now, the whole point of egg freezing is to try and secure an egg at a ideal age, essentially. Now, this all came up, the whole concept of egg freezing came up because particularly in developed countries, the issue of delaying childbearing to a later age is becoming a serious global issue. The age of first-time mothers in Australia, this is 2020 data, is 30.7, so 31 years old essentially, which is fine, but the trend is certainly heading higher and higher. Now, the reason this is becoming a global issue is because the effects of age on egg quality is one that nobody could really figure out how to overcome. Now, this graph, I'll just take you guys through. So it's the blue line is a IVF success rate using donor eggs, as opposed to the green line using a woman's own eggs. So if you can clearly see the green data points, it slowly but surely declines. But around about the 38-year-old mark, you can see this inflection point where the drop becomes quite drastic. Now, this drop that's related to age is almost completely reversible using eggs donated from younger women. So this graph essentially outlines the importance of the egg in terms of fertility. So it's not the sperm, it's not so much the uterus or the environment that the embryo grows, but in fact the egg quality. Now, the reason why this is the case, we think, is because essentially a woman is born with all the eggs that they will ever have. So we don't, quote unquote, replenish our egg numbers. In fact, the maximum number of eggs is in a fetus, a 6-month-old fetus. Okay, and as the fetus grow, the number of eggs decline, so much so that during birth, this number is probably half of what they have 6 months of age. And throughout our life, certainly throughout puberty and then throughout our adult life, this continues to get depleted. This is a histological analysis. So this is where we take an ovarian sample, cut across it, and do some staining to identify the follicles. Now, each of these follicles can potentially grow to become an egg. Now, at birth, you can see there's plenty of follicles in the ovaries. And at 25, these follicles become severely depleted, but these are still good quality eggs, mind you. So much so that we don't get too many 25-year-olds coming with fertility issues. Now, at 50, however, you can see these follicles are pretty much depleted. And this is not surprising because the average age of menopause in Australia is about 50, 51. Now, how are we able to overcome this issue of age-related poor egg quality? So a few years now, I submitted a PhD specifically looking at answering this question. So we worked in mice, and in mice, not humans, just a disclaimer, we were able to, by using a specific compound, rescue or even reverse this age-related decline in egg quality. So back then, you know, the media caught wind of it, and there was a bit of excitement. But I gotta say, this research was done in mice, right? And I reiterate this to my patients over and over again, that to go from bench to bedside, so to say, so bench being basic science animal work, to bedside, which means we offering it to humans, is a long journey. And majority of treatment that seemed promising at the bench level, we discovered for various reasons to not be quite as useful in humans. Now, this is certainly promising, but you know, I wouldn't be advocating for this treatment at this stage. Now, what can we do now, right? We don't want to wait 15, 20 years time. Now, there's some talk about lifestyle. Unfortunately, there is no strong, clear evidence that any kind of lifestyle related activities could impact egg quality. Certainly, if you smoke, quit smoking. I mean, you don't need me to tell you that. Smoking is no good for health in general, but specifically for egg quality. Otherwise, the message is the same when it comes to lifestyle. Try and stay healthy, stay active, avoid processed foods, and maintain a healthy BMI. Coffee, not a big deal. 2 shots a day. I mean, I that's the minimum that I survive on. Alcohol, like all these things, I always say everything in moderation is okay. So there are certain complementary therapies. So a good proportion of my patients before coming to see me have already tried a whole bunch of alternative therapies, acupuncture, herbs, supplements, certainly now. A lot of them, some people vouch for them, others don't. Again, the evidence is not very convincing. But as I always say, if it makes you feel good, do it, right? One thing that I'm mindful of is herbs, particularly during fertility treatment, because some of these herbs, they are very potent, but the issue is quality control. So I generally suggest cutting back on the herb or even stopping it completely. But things like acupuncture, exercises, things like yoga or a mindfulness, a meditation, I encourage patients to continue on with that because they are known to not cause any harm. Medical conditions. So certain medical conditions can predispose us to, poorer egg quality or certainly reduce egg number. So things like endometriosis, for example, which is another area of interest of mine. So endometriosis is known, at least there are more and more evidence to show that endometriosis can affect egg quality that is independent of age. So this is a disease state that can affect egg quality. There's more and more talk in the media about medical egg freezing. I think this is great. Certain conditions, for example, cancer that requires radiotherapy or chemotherapy, we certainly encourage patients to come forward and freeze their eggs prior to undergoing therapy that could potentially be gonadotoxic. So that's being toxic to the eggs. Now, in the last 10 years, there's more and more demand for social egg freezing or elective egg freezing, shall we say. This is just a graph from a recent epidemiological paper that shows a drastic increase in egg freeze cycle. This is in the UK. And certainly we're seeing that more and more of that in Australia. Now, just a little bit about the history of egg freezing. Now, egg freezing traditionally, many years ago, we used the same technology as we use on embryos. Now, mind you, embryos contain hundreds of cells, whereas egg is essentially a one-cell organism. Now, the problem with using traditional methods is that the eggs, they don't tolerate this process very well. So we lose a lot of them during the process. Now, more recently, we use essentially what we call a snap freezing process. And so we find that the eggs, they tolerate this process much better. And so a higher proportion of them survive. Now, as far as you're concerned, egg freezing process generally involve this. This is a nice summary slide. And I'll just briefly take you through. So essentially, the cycle starts on day 1 of your period. And on day 2, generally we do a blood test to confirm that you are quote unquote baseline, which means you're at the beginning of your cycle, right? Your hormones are quiescent, so we can start the injections. Now, these injections is to stimulate the follicles in your ovaries, because with egg freezing, we want to make it worthwhile for patients, right? I mean, we do our best to collect as many eggs as we can. And to do this, we need to stimulate those ovaries. And we use FSH injections. Now, after a few days of FSH injections, we'll then start you on another injections called the antagonist injections. Now, this second injection serves to suppress the brain from secreting hormones that would override what we're trying to do, right? Now, throughout this whole process, we'll be closely monitoring your blood tests and also your follicle development through ultrasound. We want to make sure that you're developing the follicles nicely. We want to make sure that your hormones are going up nicely as well. Now, when you are ready for egg collection, we'll give you a trigger injection, okay, to mature the eggs. And then 36 hours later, typically, we would then collect the eggs. And once the eggs are collected, it would then be frozen. And then that's it. as far as the patient is concerned. Once the eggs are frozen, then we're good. There's a Q&A here. At what age should I start thinking about freezing my eggs? Excellent questions. I'll address that a few slides down the track. How many eggs do you need to freeze? Now, this is again a very important question, very common but very important question. So it's a balance between egg numbers and egg quality, right? Now, the best marker for egg quality is age. There's no two ways about it. 10 40-year-old eggs, very different to 10 30-year-old eggs. Okay, and I'll take you guys through in the next few slides why this is the case. So we talk about the egg freezing attrition rate. Now, just because we freeze 10 eggs doesn't mean that down the track when it comes to using them that we'll have 10 embryos ready to be put back one at a time. Now, when we freeze 10 eggs, the thawing out process is when eggs might fall off the perch, so to say. So typically about 70 to 80% might survive. Okay, so let's say out of 10, 7 survive the thawing process. Now, out of 7, you're looking at about, because you need to fertilize them first before they become embryos, right? So fertilization rate typically is 60 to 70%. So then you're talking about 5 being fertilized. Now, we need then to grow these embryos to day 5, because day 5 is when it gives us the best chance to getting patients pregnant. Now, over the following 5 days of fertilization, you inevitably will lose one, another, and another, so much so that out of 10 eggs to begin with, we're probably expecting 2, 3, hopefully 4 embryos at the end of day 5. Now, these 3 or 4 embryos can then either be transferred and or frozen. So this is generally what we call the attrition rate. So just because you start off at a certain number doesn't mean we'll end up necessarily with the same number. Who should consider fertility preservation? So obviously women with an increased risk of premature ovarian failure. This is someone, for example, who have had repeated surgery for endometriosis or certainly ovarian cysts. The problem with that is sometimes as we remove ovarian cysts over and over again, we inevitably could injure the ovaries and therefore could increase the risk of premature ovarian failure. Someone with a family history of early menopause certainly should have some assessments, some blood tests and ultrasound to check how their ovarian reserve are looking like. Someone with a history of childhood cancer, so someone who have undergone chemotherapy or radiotherapy, particularly in the pelvic abdominal area, or someone with autoimmune diseases. We know that certain autoimmune diseases are strongly associated with premature ovarian insufficiency. Patients who are about to undergo patient treatments, and finally social egg freezing. We call it elective egg freezing these days. Few Q&A. How long can eggs be frozen for? I have heard multiples are common, whatever. People
Dave, it's Abby here, just jumping in to let you know we're going to have some Q&A time at the end of your talk, so I'm happy to read those out to you then as well.
Okay, I'll just get going with my thing then.
Yeah, thank you so much.
No problem. So some possible, why do patients who are about to undergo cancer treatments, why should they consider fertility preservation? The most the most serious problem is what we call gonadotoxic effect on the ovary. So we know that certain types of chemotherapy, as effective as they are in treating cancer cells, they're equally effective in harming ovarian cells, specifically those developing follicles. So for that reason, we know that we should secure the eggs before potentially exposing them to these chemicals. Sometimes the chemotherapy could also disrupt the brain ovarian hormonal signaling, so that could sometimes accelerate egg attrition. And sometimes you could physically damage the uterus or the fallopian tubes or the ovaries, and thereby causing fertility issues. This is a fairly common kind of structure. So we generally, someone's undergoing cancer treatment, that's the priority. I always say that women's health is number one. Therefore, we always prioritize appointment time. So a rapid response appointment with one of us within 24 to 48 hours. We then get the process going, because we want to minimize the delay to to the treatment for their cancer treatment, and therefore we generally take days before starting stimulation for egg freezing for patients who are about to undergo cancer treatment. Social egg freezing. So approximately probably 1 in 5. That's a bit of a high number. I think probably a bit less than that, but certainly we're seeing more and more women come forth with plans for elective egg freezing, and I strongly encourage this. Sometimes we discover that they're not just quote unquote social, it's actually patients with high risk. So for example, low AMH. Okay, so AMH, anti-Müllerian hormone, as far as we're concerned, is the most important marker of a woman's ovarian reserve. So sometimes during a routine checkup, we discover that incidentally you've got lower AMH. So then you come forth and we go here with egg freezing. Certainly since the COVID lockdown, we're seeing more and more women come forth with for elective egg freezing. Who is suitable? So again, this should answer the question about age. So ideally, I'd say about 29 to 35. Now, the reason we say this is we looked at, do you remember the graph in the beginning of the slides, that around about the 37, 38-year-old mark is when the inflection point starts. So that's when egg quality starts to decline. And in the next few slides, we'll talk about why egg quality is crucial when it comes to egg freezing. The older a woman is, the more eggs that we need for her to have frozen to give us the assurance that we'll be able to end up with more than 1 embryos at the end of day 5. And AMH test, as we talked about, is helpful. How many eggs need to be frozen? So this table outlines the general aim for how many eggs we want to ensure at least 1 what we call live birth rate, right? To be holding a baby at the end of the 9 months. So if you're between 25 to 34 years, 8 eggs should do the trick, but this number increases significantly as we go up in age. And this is the problem with age-related poor egg quality. So for every egg, for every embryo, we've got a lower chance of success in getting you pregnant. Again, so this table clearly states, so forget the other bit, just look at this euploidy rate. So euploid is just a fancy name for the correct number of genetic makeup within the egg. So we know that embryo. So we know that an embryo from a 35-year-old egg has more than 50% chance of being euploid. Now, euploid is important because if they have a wrong number of genetic makeup, then chances are they'll end up in a miscarriage, right? So the next age group, 39 and 40, these numbers drop to about 30%. So for every 3 embryos that we derive from 39 to 40-year-old eggs, 1 would be euploid, the other 2 will likely be aneuploid. Okay, so which means the wrong number of genetic makeup. Now, this number continued to drop so much so that by 42, only about 1 in 5 contains the right number of eggs. So you can imagine, statistically, you need to put back 5 embryos in order to achieve 1 normal pregnancy. Numbers are getting quite dire. Now, preparation for egg freezing, we briefly touched upon this in terms of the egg freeze process. And procedure for egg collection generally is done under general anesthetic, so you'll be asleep and no pain. We use an ultrasound probe, look at the follicles, and then drain the follicular fluid. And within this follicular fluid, there will be the egg, right? The scientists will then process the egg and then freeze them, stent freeze them. Generally, this procedure takes about 30 minutes, recovery another 30 minutes, and then you should be able to go home. So we briefly talked about the expected outcome. So in a woman in early 30s, we'd be pretty happy just with 10 eggs frozen, okay? Because when it comes to thawing it out and using the eggs, we expect 6 or 7 to make it, hopefully more. And out of those 6 or 7, probably about 4 or 5 would fertilize, right? And then over the next 5, by the end of day 5, we're hoping that we get 2, hopefully 3 embryos, and we'll put back 1 and freeze the rest. I think we'll save the questions for the end. Thanks very much for for paying attention.
Thank you so much, Dave. That was wonderful, and so much, great information around the egg freezing process there that I'm sure our audience is very, very grateful for. And I will preempt any questions around whether or not there will be a replay for this. If anyone wants to go through anything again or share any of this information with someone they may think relevant, that'll be sent out in the coming days, but via email to anyone that's registered. What I'd love to do now is, before we go to questions for Dave, but please keep sending them through, is Dave, you can hang around if you'd like. We're going to chat to Marianne and ask some of her some questions of Marianne around her experience of the egg freezing journey, which is super valuable, and just to get that perspective. So welcome back, Marianne. Thank you so much.
No, thank you for inviting me.
We really appreciate your honesty and generosity in doing this for us. Again, if you have any questions for Marianne, please pop them in the Q&A box as well. But to start, Marianne, wanted to ask what might be an obvious question. Why did you decide to freeze your eggs?
I decided last year to freeze my eggs as we all went through a COVID pandemic. It was always on the back of my mind, and I did have family saying to me, why don't you look into doing it? And I do suffer from polycystic ovarian syndrome, so PCOS, and I was having some issues. So I was getting checked. And I just thought, you know what, we're in the middle of a lockdown. What have I got to lose? I've got to go and get tested for my PCOS. So I decided to get a referral and see where I sat with my fertility, because I wasn't meeting anyone. We were all in lockdown. We couldn't go anywhere. So I thought, what have I got to lose to find out where I sat? So I went ahead and did it, and it was the best decision I did.
So wonderful. Good on you for making that decision as well. And yeah, really excited to kind of get into that story a little bit more. So I guess just starting off, what were some of the expectations that you had about how that process would be?
The expectations I had, I didn't have any expectations. I sort of just jumped and went for it. But when I did jump, it wasn't as hard as what I thought it was going to be. Like when it was initially spoken about, I thought it wasn't going to be as hard. But then when I got into it, I realized how hard it can be. So I didn't have any expectations. I just thought, let's just start and see where it goes and take it from there. And I thought it was going to be a lot more. I had ideas that it was going to be a lot more, and then yeah, all my questions were answered with my doctor. So I didn't have much of an expectation. I kind of just made the decision and jumped and didn't think.
Yeah, awesome. And so obviously Dave's talked us through the process, but you know, in your own words, how was the process? What was the process that you went through?
It was a lot harder for me than what was initially brought to me. So initially I thought I could have been done with a month. And yes, for some women it has, and that I know of, it has happened within a month. They've gotten the desired amount of eggs that they've needed and they're done. But for me it wasn't, and it took 5 cycles. And I did cancel cycles as well along the way. And we had to go back and tweak medications and to get to where I needed to get to to a good number, not my goal number, but I got to a good number what I needed to get to. But it was a lot harder. There was a lot of tears. There was a lot of upset and disappointments and all of that. But I had a good network around me, and I had a lot of people around me who supported me and were saying there's a reason why you're doing this, so don't give up. And I didn't. So it was hard, and I did struggle a lot, and it did take me 5 cycles, so a total of 9 months really to do it, which in 9 months you can have a child, but it took me 9 months to get through it. And yeah, it was hard. I'm not going to lie, it was hard for me, but for some other people it wasn't. So I did struggle a little bit, but that's okay.
Yeah.
It was part of my journey.
Yeah, absolutely. And why we're so grateful for you to sort of revisit that and share with us. So is it right to say that there was a certain number of eggs that you were aiming for after consult with your doctors? And so the number of cycles required ended up being what they were in order to achieve close to that number?
So my desired number was 20 to get to 20 eggs, and I would have been happy with that. And then after the cycles, we were doing the first cycle and we cancelled it, and we did the second cycle and we cancelled it, and by the third cycle we had to have a discussion, and it was, let's just get to 10. And we went, okay, let's just get to 10 and take it from there. By the fifth cycle we got over 10, but I was only getting small amounts. By the third cycle, when I went for my first retrieval, it wasn't great. So, and then the fourth cycle by that stage wasn't great, but we got there by the fifth. But yeah, it was 20, and then by the end I had to have the discussion, go, well, let's just get to 10. If we can get to 10, we'll be great. So that was the numbers for me.
And you mentioned that it was a difficult experience for you. Can you talk a little bit about that and some of the aspects that were challenging for you in the experience?
Yes,
if you're comfortable.
No, I'm happy to talk about it. So the struggles I dealt with was, you all of a sudden your hormones are stable and all of that, and all of a sudden you're injecting yourself with these hormones, and your hormones will go up and they'll come down and they'll go up again and they'll come down again. So I struggled a lot emotionally, and I was doing this on my own. So even though I had people around me, I don't have a partner. So for me, I was internalizing a lot of the emotion, and that
Sure.
was what I was struggling with. Now, in terms of my injections, I couldn't do my injections. So I had to have family, and I had a great family around me. So my mum was giving me my injections, and if it wasn't my mum, it was my aunties, and if it wasn't my aunties, then one of my cousins was giving my injections. So someone was around me, because I was dealing with everything on my own and going to all the appointments on my own and getting blood work done and ultrasounds done and going into the clinics and into the hospital for egg retrieval on my own. I just needed to be able to give something to someone else to do for me, even though I did all the measurements and got all the needles ready and everything, but I couldn't do it. So I struggled. That was one of the things that I couldn't do. And that was okay, because I needed to be able to give something to someone.
Yeah,
and it
absolutely.
was nice to be able to have someone there to help me through it when I was struggling. So I did struggle a lot with the aspect of the needles and things, and I got through it in the end. And it does play a toll on you, but you get through it because you've got all these people behind you, like cheering you on, going, you're doing this for a reason. It's 10 to 12 days. You can get through it. You can get through it. You can get through it. And you do get through it. So that was where I struggled quite a bit. And even after the retrieval, I did struggle a little bit emotionally, but I did things like acupuncture to help with all of that. So I got out and I did different things to try and get me to where I am.
It sounds like support was really important, and I love
Yes.
the fact that you were able to assign, what you could, or certain parts of the experience that you could outsource, I guess,
Yeah.
to your support network. Needles would be, I imagine, a good one to
Yes.
outsource, rather than having to kind of overcome that yourself. So it sounds like a support network was super important, and
It is.
to get you through. You mentioned that acupuncture helped you through the experience, and I did want to ask you more broadly what additional support and modalities may have helped you as well. So can you talk about acupuncture and how that helped, along with anything else that was supportive at that time?
So acupuncture, it's great to find a really good acupuncturist, and I already had one, and she's amazing. So when I did speak to her about going through and doing the whole fertility journey, she sat down and she did a program for me to figure out what to do. I found it helped more for me after egg retrieval, because you're quite bloated after egg retrieval, that it did help a lot with the bloatingness and also stabilizing your emotions and things like that. So it did help. They do say that it helps stimulate your ovaries and do all of that sort of thing. Whether it helped or it didn't help, I don't know. But for me, it felt good, more so from an emotional point of view, because it helped stabilize me and help when I was having those days where I just wasn't coping. And I would go and I would have a treatment, and I found it calmed me a lot. It helped a lot, like I said, with the bloating, and after the surgery, that helped a lot. I also did yoga. So I did do a lot of yoga and going out for walks and stuff, just to get your body moving and just to get you out of the house, because you do tend to internalize a lot of things and you're in your head about it a lot. So it was good to be able to get out and do just a little bit of yoga, a little bit of stretching, gentle yoga, a bit of walking. I did take herbs and supplements and stuff, but again, I did consult my doctor and say, am I okay to take these, or am I not okay to take these? So I sat down with my doctor, and if I couldn't get a hold of my doctor, I would message my nurse and say, are these okay? Can you check to make sure that these are okay to take? So I did do all of that, but again, I made sure I consulted everybody, and I made sure it wasn't going to interfere with everything. So I did try and I did everything and watched what I ate as well. So.
And was that in order to make sure that you were nourishing yourself and looking after your nutrition throughout that process as well?
Yes.
Well, it sounds like you're a model patient. You did all the right things and taking really good care of yourself as well, which is a great message. You mentioned that you had your mom and your lovely aunties and a good community around you. More broadly, where else did you find support throughout the process? Were there any kind of groups or any resources that you leaned on or looked into during that time?
I didn't have any groups or anything, but I did do a lot of research. So I did get on and have a look. I researched everything. So from medications to everything. So I made sure I researched everything, not from perspective of go, I'm all right on the right medication. It's more so I could understand. And if I did have questions, I could go back to my doctor and say, am I understanding this right? And also from the point of view of like, okay, so I am experiencing these side effects. Like, it's normal. Like, don't freak out. It's normal to have these side effects. So I didn't join any groups or anything like that, or like Facebook groups or anything like that, because I did have friends who I'd known had gone through it. So if I had any questions, I could go to them. And it was, in the beginning, I didn't open up about it. I internalized it a lot. And I'm glad in the end I opened up, because there was so many women out there that had gone through it that I didn't know had gone through it. And then they explained their story to me. So it was nice to be able to then speak to them and say, okay, is this normal? Am I feeling this right? And they would reassure me. So it was good. That was where I was getting a lot of my information from.
Yeah, I can imagine it must have felt really good to be able to connect with people that had actually walked through that experience, just because it is so kind of unique, isn't it?
Yes.
And I imagine quite hard to for people to really understand what it's like if they haven't been through it. But that's also why we're so grateful for you to be sharing it with us, so we can have more conversations about it. So Marianne, how long will your eggs be frozen for? The 10 that you retrieved?
Look, I don't have a time frame. I'm saying 5 years, hopefully, but that all comes down to if I meet someone in the next year or so, or if I get married, or if I meet someone, if it works out and I do fall pregnant naturally, because you do have to try naturally first, and I might not need them. But if I do need them, I'm aiming for 5 years, but it could be less. If I'm struggling and it's not working for me, then it might be less, or it might be more. But I'm aiming for about the 5-year mark to use my eggs.
And it's good to know that you don't have to know now as well.
Yeah, exactly.
Right.
It's taken a big weight off my shoulders. So I have to admit, it's a big weight off my shoulders.
And so would you say that this process itself, although challenging, was empowering for you? Because when we've spoken previously about this, and you've been so keen to share your story, you say, I'm so glad I did it. I'm so glad I came out the other end. Can you talk a little bit about coming out the other side and how you feel about the process?
I put it this way, when you're in it, yes, I'm not going to lie, it was hard for me. It might not be hard for you. It was hard for me. But I do not regret the 9 months that I've gone through. I do not regret what I've learned. I do not regret what I've gone through. I don't regret any of it whatsoever. It's taken a big weight off my shoulders to be able to not have to worry and go, oh my God, the clock's ticking and I need to like meet someone and get married and do all of that. It might not happen. I might not meet someone, and that's okay, because then I can just go and have a child on my own if I wanted to. So there are options for me now that I'm not stressed about it, and I don't have to worry because I'm from my background. It is put into pressure for me and say, well, when are you going to get married and when are you going to have children? I'm like, well, I don't have to stress about that now because I've got my eggs frozen. When I decide I want to get it done, I'll get it done.
You've got an answer for those people now.
Yeah, I've got an answer. Exactly. I do have an answer for them.
When I'm ready. Yeah.
When I'm ready, I'll go and get it done. And it's funny to see those people's reactions when you've told them that what you've done. They're like, oh, you've done that. I'm like, yeah. And a lot of people have cheered me on for it. And then you get the 1 or 2% that look at you and go, well, why did you bother? And I'm like,
right.
well, I bothered because I wanted to bother.
Yeah.
If you're sitting on the fence about it and you're wondering, should I do it? Should I not? Oh, I'm worried that, it's going to impact my life in some way. Yes, you will. I put on weight and that's okay. I put on weight. I'm now working to lose it all. Yes, it might put a financial strain on you. But at the end of the day, if you really, truly want to have children and you really want to incorporate that in your life, just take the leap and jump, because you've got nothing to lose, but you will always regret it if you don't do it. So my advice is, I jumped, and I'm so glad I jumped, and there was a lot of tears and there was a lot of upset results. But for me, I do not regret it in the slightest. It was the best decision I made. I wish I made that decision earlier when my family were telling me to go and get it done. I was like, no, I'm not ready yet. I'm not ready yet. And I wish I made it earlier, because it would have changed me completely. And I'm not the same person who I was 9 months ago. So I don't regret it in the slightest. It was hard, but it was the best decision I made.
Oh, wow. That's really powerful. And you pretty much did answer my last question around what advice you would give someone else going through the process. So thank you, Marianne, so much for that. Wonderful words to finish on there. But what I would love to do now is invite back Dr. Dave Listijono, and Marianne, you hang around too, because we've got a number of questions that have come through from our audience, and I'm going to ask them of the both of you for the next sort of 10 minutes or so. So if you've got a question, please feel free to pop it in the Q&A box. I'm going to jump straight into the first one here, which is probably for you, Dave. How long can eggs be frozen for?
Yes. Firstly, Marianne, thank you very much for being so open and having a frank discussion about this. I think you know what you just described. I think a lot of people would appreciate how tough it could be.
And thank you for inviting me. If I'm helping anyone, that's all I want to do. I just want to help as many people as I can. Yeah, so if this helps anyone, I'm glad.
No doubt you have.
I'm sure there's a lot of people who are listening tonight and feeling really grateful to hear your experience and share that story. Agreed. So thank you.
Agreed.
You're welcome.
Eggs can be frozen indefinitely. Yeah, we know that once eggs are snap frozen, they're inert. Okay, so that's the whole point of doing egg freezing, is we want to collect it at the stage where the quality is excellent, rather than wait for the quality to deteriorate. So however long that you need.
And just on that question that came through asking, will a pregnancy with frozen eggs be the same as a typical pregnancy?
Yeah, so Marianne mentioned it in her talk. You know, I always encourage patients, even if they have frozen eggs in the freezer, we just say, hey, try naturally. The whole point of having eggs frozen is as an insurance policy, right? Ideally, you know, you'll try and fall pregnant and conceive spontaneously, right? But then if we do end up needing to use them, then we go through the process that we just talked about, thawing it out, fertilizing it with the sperm, growing it into day 5 embryos, and then putting it back, right? And then freezing the rest if we happen to have more than 1 embryo. Now, a baby that's sorry, Abby, the question is a pregnancy that's conceived.
Is the pregnancy the same?
Yeah. Yes. So essentially, it's the same as a IVF pregnancy using frozen embryos, right? Because essentially, you're putting back the embryo after having what do you call it? Thaw out the egg, and that's essentially normal. Now, we we're seeing more and more evidence to show that pregnancy from a frozen embryo transfer have got a slightly higher birth weight than normal pregnancy. But that, apart from that, that doesn't seem to cause any issues, at least from what we could see. So essentially, yes, it's the same as a normal pregnancy. So once you're pregnant, then that's it. And we care for you as we would any other normal pregnancies.
Wonderful. Thank you for answering that. I've got a question for you, Marianne. Did you feel satisfied with how safely your eggs were stored during the process?
Yes, I did. I didn't. I think the most important thing, you need to trust your doctor and the team. So if you trust your doctor and your team, and you can have an open and honest conversation with your doctor and the team, then yes, I didn't, not even the slightest. I didn't even cross my mind, because I knew my doctor was going to do everything possible to make sure that I was okay, and I had that trust. So I didn't even cross my mind.
Yeah, wonderful. And that trust is really important. It sounds like you have, you know, quite an intense relationship with your doctor. You really do get to know each other. It is quite an intense process, right, over that 9-month period, and very collaborative also, from the sounds of it, in terms of the decisions you're making along the way. Would you say that's correct, Dave, as well, in terms of the experience being somewhat collaborative around having to make decisions?
100%. I mean, my thing is, you know, it's not a one-way thing, it's a two-way thing. So we offer you options. We say, hey, this and this, and then, you know, Marianne mentioned about having certain side effects, and it's a two-way thing. And you know, adversity shapes character, and it builds relationships.
Yeah, absolutely. Yeah, it's quite awesome.
Like there was one stage where I turned and I looked at my doctor, because I was struggling or whatever, and I turned and I said, just don't give up. Just don't give up on me, because I'm not going to give up. So don't give up on me. And they didn't give up, and we got there. So you've just got to have that open and honest, feel comfortable with your doctor. That's my one thing I'll say. Feel comfortable with your doctor and be able to have an honest conversation with your doctor. That's the one thing I'll say.
Yeah, that is such good advice. Marianne, someone asked if you'd feel comfortable sharing whether your AMH and ultrasound results influenced your decision to freeze your eggs.
Yes. So I remember this. I got my referral from my gynaecologist to go to see a fertility specialist, and it all happened within a month for me. So literally I had my appointment, got in straight within 2 weeks to see the fertility specialist, and then we had a conversation, and I went for blood tests. I remember this, it was on a Saturday, went for my blood test, and by Monday morning I had my doctor call me and say that my AMH was low. It was 5%. So it would be advised that I start or look into freezing my eggs. So yes, so I had already had an ultrasound prior with my gynecologist, because I was having issues with my PCOS. So we had seen the ultrasound, everything looked okay in the ultrasound, but my blood work indicated, and that's when I just did we're just doing this. Like as soon as I heard that, I went, I want to have children, so I'm not mucking around with this. I'm just going to jump, and I jumped.
You truly did jump.
Yeah, I did. I literally just jumped. There was not even, it literally happened for me within a month. Like it all just happened. It was like bang, bang. And there wasn't even any thinking. So yes, my AMH did influence me to go and get it done. I didn't even think twice about it.
And very quickly, do you mind sharing what age you started the process with our audience? There's a couple of questions around that.
I was 33 years old when I started. So I'm now 34 and I'm going on to 35. So that was also a factor as to why I decided to do it as well, because I'm not getting any younger and I'm at that age where I need to make these decisions.
Yeah, absolutely. Thank you for answering all of our questions. Dave, question in regards to multiples. Someone asked, I've heard multiples are more common with IVF. Do people ever opt to have just one egg fertilized?
Good question. So the reason why you've got, you hear a higher risk of multiples is because of more than one embryo being transferred, right? So obviously, if there's more than one embryo, then your chance of twins are higher. Now, in Australia, the general recommendation is for single embryo transfer. So in the world, we're actually world leaders in terms of minimizing the risk of multiple pregnancy. Number one. Number two, we know that an embryo that's put back in IVF have got a higher risk of splitting. So just from a physiological perspective, that increases the risk of multiple pregnancy. Now, when you talk about fertilizing one egg, generally we don't recommend it because of the whole attrition rate that we talked about earlier on, right? So if you fertilize one, then generally you got a 70% chance that it'll get fertilized, and you got a 30% chance that they won't fertilize. So you don't want to be wasting the whole cycle. So generally the advice is to fertilize all the eggs that you got and then grow them to day 5 embryos. And now those day 5 embryos, you can choose what you want to do with them. You can transfer one, you can freeze the rest, or you can freeze all of them, right? But generally the advice is to fertilize as many as we can afford to. And by the way, if you've got, say, 20 eggs frozen, right, you don't have to thaw out all 20 and fertilize all of them. If they're frozen in batches, then you can say, all right, I want to thaw out 10. So you thaw out 10 and you keep the other 10 eggs frozen, right, for whatever reason. So I've had patients who say, hey, I've got 20 eggs frozen, I just want to use 10, for example, and that's fine. So, but generally I would suggest fertilizing more than one egg.
Yeah, makes sense. Thank you for explaining that. We had a question for you, Dave, whether or not there were any risks to the baby by doing IVF.
Great question. So IVF conceived babies are one of the most intensely studied populations, right? We don't want to be, in the process of getting you pregnant through various technologies, we don't want to be causing harm to the offspring. Now, so far, no, there is nothing to show that IVF conceived babies are any less inferior than naturally conceived pregnancies. We know that IVF pregnancies, however, generally have got a lower birth weight. Okay, so that's one. We know that IVF pregnancies have got a higher risk of blood pressure problems during pregnancies. But these are manageable conditions. Babies themselves, no difference than a naturally conceived baby.
Okay, thank you. Look, we've had a couple of questions in regards to people's personal situations, and we won't be able to address those directly in the webinar, only sort of coming from a more general perspective due to the nature of the event. However, what we are putting in the chat box is the details for IVF Australia and a phone number if you wish to further explore your own situation or pricing, etc. as well. Jumping back to a question on frozen eggs, Dave, what happens to them if someone chooses not to use them? Are they disposed of or donated or further stored?
Yep, you own those eggs. You tell us what you want to do with them. You can discard them. I wouldn't recommend it. I mean, you can keep them for as long as you want, because people's plans change. So you don't want to bite the bullet in the sun, on a whim, just discard them. Not easy to get to the stage of frozen eggs. You could donate them to research. Okay, there's a few avenues for those. So you have options. So
okay, great to know. Thank you. Yeah, great to know. Thank you. Someone asked, they said that they've read only about 10% of women use their frozen eggs. Is this because doctors will always try IVF with fresh eggs first, and usually this is successful?
Yep. Good question. Yes, the short answer is so firstly, before we say, hey, throw out those eggs, I would say try naturally. Right? Free can be pleasurable. So try naturally first. If this fails, then we'll reassess the situation, right? If you're at that age where your fertility window is closing, so let's say you're late 30s and you've got eggs frozen from 8 years ago when you're in early 30s, then I'd say keep those eggs, right? Because those are valuable commodities. So we could try running a cycle using your current fresh eggs, making fresh embryos, and then transferring one back. And yeah, the short answer is we tend to be quite successful doing that. So then those 10 eggs that you got frozen, just keep frozen, right, for your second, third child. Now, if, however, you then come back when you're, say, early 40s, then I would say, you know what, probably we need to weigh up the chance of you conceiving through a fresh cycle using 40-year-old eggs, as opposed to throwing out those eggs and fertilizing them and then getting you pregnant. And in those situations, most of my patients would choose to thaw out those eggs. And so we won't waste our time or money with running a fresh IVF cycle using 40-year-old eggs.